Hello everyone, I am S. Chandrapawan. USN is 1VE21CA041, 4th SEM CSEI, currently studying in Sri Venkateswara College of Engineering. Today I am going to explain the topic lungs. The lungs are the primary organs of respiratory system in humans. Humans have two lungs, one on the left and one on the right. They are situated within the thoracic cavity of the chest. The right lung is bigger and heavier than the left, which shares space in the chest with the heart. The lungs together weigh approximately 1.3 kgs. The lungs are part of lower respiratory tract that begins at the trachea and branches into the bronchi and bronchioles, and which receives air breathed in via the conducting zone. The conducting zone ends at the terminal bronchioles. These divide into the respiratory bronchioles of respiratory zone, which divide into alveolar ducts that give rise to the alveolar sacs, contains the alveoli, where gas exchange takes place. Lung anatomy basics. There are the airways, the thorax, the breathing muscles. The airways. The larynx, trachea, bronchi, and bronchioles all work together to move air in and out of the lungs. The thorax. The lungs are housed in the thorax, which also contains the heart, blood vessels, and other vital organs. The breathing muscles. The diaphragm and intercostal muscles work together to control the movement of air in and out of the lungs. Alveoli and gas exchange. The alveoli. The millions of tiny air sacs or alveoli are where the exchange of oxygen and carbon dioxide takes place. The respiratory membrane. The walls of the alveoli and surrounding capillaries form a thin membrane that allows for efficient gas exchange. Oxygen transport. Oxygen molecules bind to hemoglobin in red blood cells and are transported throughout the body. Carbon dioxide elimination. Carbon dioxide is transported back to the lungs and exhaled out of the body. Out of the body. Pulmonary circulation. The pulmonary artery. The pulmonary artery carries deoxygenated blood from the heart to the lungs. The capillaries. In the lungs, the pulmonary artery branches are into capillaries that surround the alveoli. The pulmonary vein. The pulmonary vein carries oxygenated blood from the lungs back to the heart for distribution throughout the body. Lung volume and capacities. Measuring lung function. Spirometry measures lung volumes and capacities, which can help diagnose and monitor lungs disease. Diagnostic imaging. Chest X-rays and CT scans can provide detailed images of the lungs and surrounding structure. Other tests. Other tests may be used to assess lung function, such as gas diffusion tests and bronchial provocation tests. Respiratory mechanics. Inhalation and exhalation. The diaphragm and intercostal muscles works together to expand and contract the chest cavity, allowing air to flow in and out of the lungs. Lung compliance. Lung compliance refers to the ability of the lungs to stretch and expand. Factors such as age, disease, and injury can affect compliance. Airway resistance. Airway resistance is the flow of air through the airways, which can be influenced by factors such as inflammation, obstruction, and narrowing. Lung disease and their impact on architecture. Asthma, inflammation and narrowing of airways, shortness of breath, wheezing, coughing. Treatment, steroids. Emphysema, restriction of alveoli valves, shortness of breath, coughing, barrel chest. Treatment, smoking, uh, oxygen therapy. Lung cancer, uncontrolled cell growth in the lungs, coughing, chest pain, shortness of breath. Treatment, surgery, chemotherapy, radiation. New therapeutic strategies. Gene therapy, replacing or repairing faculty genes that cause lung disease such as cystic fibrosis. Bioengineering, creating artificial lungs or lung tissue for transplantation. Immunotherapy, stimulating the body's immune system to fight lung cancer or other disease. Conclusion. Prevention, avoiding smoking, pollution and other environmental toxins can help reduce the risk of lung disease. Healthy lifestyle, eating a healthy diet, exercising regularly, and getting enough sleep can also promote lung health. Future research. Ongoing research is continually uncovering new insights into lung anatomy and function, as well as new treatments for lung disease. Thank you.